Good morning, everyone. And first of all, thank you very much for the invitation to be here to open this event and to hear from some of the patients speaking here today in particular. I'm going to divide my remarks really just into two parts. A little bit about the health service in general, and then maybe something about connected health and e-health and ICT, which I probably know less about than anyone else here in this audience, but perhaps there are a few reflections that I can share with you. I think it's fair to say that the health service has gone through a number of very difficult years, perhaps the most difficult years in the last generation as a result of a very deep recession. There's been a lot of structural reform, a lot of upheaval. We've fewer staff than we had 7 years ago, and between 2008 and 2011, under the last government, the budget for health was cut back by about $1.5 billion, which is a very deep cut. Under the current government, the budget actually hasn't been cut; it's stayed the same. In fact, it's actually increased slightly. But as you all know, that doesn't tell the full story, because with the rising population and an ageing population in particular, we probably need more resources every year just to stay still in terms of service delivery, and that has been a real difficulty. You'll know from the media and the papers, and what we all know from our own experience, that while waiting lists and things like trolley numbers are better than they were in 2011, they've started to deteriorate again in the last few months, which is very worrying. And certainly staff morale and morale across the health sector is definitely not what we'd like it to be. I do think, though, when we hear about health and we talk about health, we do tend to focus on the things that aren't going right, whether it's the waiting list for the Fair Deal or overcrowding in emergency departments, or indeed an IT project that has gone way over budget or turned out not to be what it promised to be, or an IT system that's crashed, which of course happens as well from time to time. But there are, I think, a lot of good things happening as well in the health service, and it's worth reflecting on them from time to time. Certainly I'm a big fan and big supporter of the clinical programmes, and from the time that I worked in healthcare, just to see how well the stroke programme has worked, for example, the fact that we have one of the highest thrombolysis rates in the world now, saving one life a day and saving one other person from long-term disability. And similarly, when it comes to the programme for acute coronary syndrome, the fact that people get primary PCI in a way they wouldn't have had years ago is making a huge difference. We have, of course, the HICWA inspections, which I know can be annoying sometimes, but I do think they've genuinely raised standards across the health service and forced us to improve standards and face up to low standards where they do exist. MRSA and C. diff infections are way down, and we're meeting all our targets in that regard. We've much more day surgery than we had before. Ambulance response times, notwithstanding their problems, are improving, and we do have an air ambulance now, which has made a big difference, I think, for people in the Midlands and the West. And for areas like things like COPD and general medical admissions, the average length of stay is down. Just to take COPD, for example, it's down from about 9 days to 7.5 now. And part of that is due to supported discharge in the community, but also the use of things like telemedicine. We, believe it or not, have more GPs and more doctors in the health service and more dentists in the health service than we've ever had before. And the number of administrators is at the lowest since the HSE was established, although you wouldn't believe that, but it is actually true. And of course, we're doing a lot more in screening, things like diabetic screening, things like colorectal screening, and the extension, of course, of breast check next year. I think are big improvements. And of course, we've the clinical leads now, which I think makes a big difference, because we've frontline professionals in leadership positions and management positions, which I think will produce real results in the future. So while I think we should certainly never run away from the problems in the health service or deny them, I equally think it's very important that we find some space to showcase what's good and to talk about some of the good things that are happening. And I think this event can help to do that as well. In terms of the priorities for the next little while, obviously my first priority was to put in place a realistic budget for 2015 and to end the cycle of cutbacks. As a result of the budget announced a few weeks ago, that's been achieved. We'll publish the service plan on Thursday, and that does indicate the first increase in budget for 7 years. which is a big positive. And indeed, the budget for IT will be increased from about 40 million to 55 million next year. It's still way short of where we need to be, but it's a 30% increase in the IT capital budget for 2015, which is very significant. It certainly does not mean that we're awash with cash. We're nowhere near that. When you take account of the deficit for this year, which will run through to next year, we've a small amount of additional resource to use, but we're certainly not in the situation whereby we can meet every priority or do everything we'd like to do. And I think more and more, as patient groups and as clinicians and as politicians, we're all going to be faced with the same challenge of choosing one resource over the other. And we're not in a position where we can invest now to save later. Really, any new programme or new investment will have to come at the expense of a less valuable one that would need to be discontinued. And it's hard to face up to that, but it's something that we do need to face up to, and it's something that is done all the time in other walks of life. We will be continuing with the health reform programme. The hospital groups, all the CEOs are appointed now. We should have all the boards in place by the end of the year, and I'd hoped them to have their MOUs agreed with their academic partners and with the academic partners and the HSE by the end of the year. We're in a position to speed up our capital programme slightly. All things going to plan. Work on the new Children's Hospital will have started by this time next year. The move from Holles Street to Vincent's is on schedule. The planning permission for the new Central Mental Hospital in Portrane is in. We're building one primary care centre a month, and we hope to increase investment in community nursing units in particular. Again, all things going to plan. Early next year, we'd hope to deliver on the first phases of universal healthcare, which is GP access without fees for the over 70s and under 6s. That's now the law. It's just a case of agreeing the details of that with the professionals, and then moving quickly on to the next stages, which are things like bringing chronic disease more into primary care, which I'm very committed to. We hope to contain the cost of medicines and bring them down if possible, stabilise the cost of health insurance. The number of people with health insurance has fallen from about 50% to 44% in recent years. We think we can turn the tide on that next year. We've set aside about 25 million to deal particularly with the issue of delayed discharges. About 750 people in our hospitals at the moment who don't need to be there, who obviously, because they can't be discharged home or to a nursing home, are impacting on overcrowding in the EDs and impacting on waiting lists. And we hope to inject some resource into the system in December and January to get that down significantly. And obviously I'm very committed to promoting public health and Healthy Ireland, and I should have the heads of the public health bill to govern by the end of the year, and that involves a number of actions around alcohol in particular, but also things like obesity. I suppose turning to e-health, as you'll know, e-health is a priority for the government and for me very much as Minister too. Connected health, I think, can be a real catalyst for change and reform and for a better health service, and also can be a catalyst for economic growth and employment. And that's evidenced, I think, by the fact that Enterprise Ireland is here, because there's a recognition that there's revenue and employment that can be created by this. And people often see the health service as a drain on resources or as a drain in the exchequer, but I think that doesn't see it clearly, because there are over 100,000 people employed by the HSE or contracts with the HSE alone, so it's a huge employer. And as well as that, there are huge numbers of people employed in the pharmaceutical industry, in medical devices, in research, and in areas like medical technology, medical information technology, which in turn brings enormous revenues into the state as well. And I think we need to be more appreciative and cognizant of that. I think e-health as well can improve the way that we manage chronic diseases in particular, and alongside telehealth and telemonitoring, it can help patients to get the right care in non-acute settings and in the community, and of course continuing care, as the last speaker touched on, in between those rather infrequent hospital appointments. It can also provide better access to services, monitor quality and safety, and empower individuals to look after their own health and engage more in self-care and self-management, as well as supporting economic growth and innovation. As you know, last December, the Department of Health published an e-health strategy for Ireland, and that recommended the setting up of a new entity, eHealth Ireland and the appointment of a Chief Information Officer. That new Chief Information Officer has been appointed. His name is Richard Corbridge. He's the CIO, or the outgoing CIO of the Clinical Research Network in the United Kingdom, and will be taking up his post here in Ireland in the next few weeks. I haven't yet managed to find a diary slot to meet him, but I'm very keen to do so because, of course, he's been his first task really will be to set up eHealth Ireland within the HCSC on an interim basis, but really to lead a programme that will bring Ireland into the 21st century when it comes to information technology and how we use it in the health service. The eHealth strategy, as you probably know, sets out some specific measures to benefit individual citizens, public and private healthcare, and it shows how eHealth can deliver health system reform and changes at a structural and financial level, create new efficiencies in the health service, including better use and optimisation of resources, and also ensure that Ireland's healthcare system can respond to the European Union's goal, which is to give all citizens access to a high level of healthcare anywhere in the Union at a reasonable cost. And that's set out in the Redesigning Health in Europe for 2020 document. The strategy also sets out the potential for eHealth to drive economic growth and development, but most importantly to empower each patient in their own health and well-being. I believe that by empowering patients we can help deliver much safer healthcare, and modern eHealth and connected health can help patients to manage their own healthcare, especially those suffering from chronic diseases, many of whom are here today. It also has benefits in terms of patient education and awareness, and I think that if people can access accurate and quality medical information much more easily, it can lead to much more timely interventions. But I think we must always be aware of the dangers of misinterpretation or of misleading or of wrong information. Another piece of legislation that's just gone through the Dáil is the Health Identifiers Act of 2014, and that's going to be a key factor in delivering our health services for the future. It's going to allow us to create a system of individual health identifiers for patients, as well as professionals and organisations. And these health identifiers will underpin patient safety and efficiency while ensuring privacy and confidentiality. In one of the earlier iterations, it was proposed to use the PPS number to do this, but I think after the debacle of the past few weeks, I'm probably glad that decision was not made, and the health identifier will be a separate number kept separately, so that health information is kept separately from any other information that people may have. I think it's going to be crucial, and particularly allowing us to track patients through the health service, which is very difficult at present, and will also give us invaluable data on how patients are getting on and allow us to develop a lot more disease registries than we currently have. I have to say I really want to welcome the fact that IPPOSI is discussing connected health today. I think we can all learn a lot from each other's experiences and learn how best to develop opportunities from technology and improve business processes. Last week, the Secretary General of my department, Jim Breslin, referred to the creation of an Irish health ecosystem when he addressed the annual conference of the Health Informatics Society of Ireland here in the Castle. And the whole idea of the eHealth ecosystem is to bring eHealth stakeholders together, including healthcare providers, academics and industry. And I want to make sure that patients in particular are represented in this so that their perspectives are heard, their insights utilised, and so they can guide us in the development of connected health and technology. I particularly want to wish everyone here today, and particularly those who have come from overseas, a very productive and enjoyable stay here in Dublin. I really want to thank IPPOSI and UCD for organising today's event, and I particularly want to thank Evelyn Mulroe for inviting me to be here today, and Professor Brian Caulfield for asking me to speak about connected health and how it can fit into our broader health agenda and improve patient care. So I really hope that the day turns out to be very valuable, that is very successful, and I certainly look forward to receiving updates on the development and progress of this remarkable new partnership. Thank you very much.